another chat with Dr. Abrams this afternoon, and we're going to get a little personal today to learn more about Dr. Abrams' own supplement regimen. So, ready to get started, Dr. Abrams?
Sure. Yep.
All right. So let's start with answering the question whether you take a multivitamin yourself.
So that's a great question. I do still believe that most of our nutrients should come from foods. However, there are some vitamins, for example, that we probably should supplement, particularly as we age. However, I don't take a multivitamin for two reasons. I used to smoke cigarettes, believe it or not, for an oncologist, and studies have shown that beta carotene or vitamin A supplementation can lead to an increased risk of lung cancer in people who have smoked. Plus, I have a prostate, and studies have shown that vitamin E supplementation actually increased the risk of prostate cancer in men when they were looking to see if it decreased it. So those are two fat-soluble vitamins, which I don't need more of. And so I don't take a multivitamin, no. And I don't recommend it for my patients unless they have dietary insufficiencies and they're unable to eat healthy food.
So are there any vitamins or supplements that you do take?
So yeah, let's start with vitamins. So definitely, as I mentioned, some nutrients we tend to be deficient in as we age. So vitamin D, the sunshine vitamin, more of a hormone really than a vitamin, is decreased in people over 50, overweight, or with more pigmentation. And in my clinical practice, the majority of the cancer patients I see are vitamin D deficient. In fact, it's the only blood test that I order. And low vitamin D, we think about bone health, but it's really depression, pain, and people with low vitamin D are at greater risk for cancer, and people with cancer whose vitamin D levels are low don't do as well as people whose vitamin D levels are higher. And I think vitamin D is important for immunity. It's not like there's a flu season with viruses waiting offshore. It's we as a herd become vitamin D deficient when the sun goes below where it goes in the fall and winter. So I take vitamin D. I also think vitamin C is good for the immune system, and it's a good stress vitamin. People tend to overdose on vitamin C. I went to a conference once where I learned that the maximum amount of vitamin C that we can absorb from a single oral dose is 240 milligrams. So anything more that you take of that, you're pretty much peeing out. Vitamin C is good for collagen and wound healing. So I like my patients who are having surgery to take some vitamin C for 2 weeks before and 2 weeks after if they're not taking it regularly. I also take an antacid, and we need acid to absorb nutrients from our food and vitamins. Perhaps the most important one that's jeopardized by antacids is vitamin B12, which is important for our brain and nervous system. So I do take a little vitamin B12, not every day, but a few times a week.
What about supplements and minerals? Do you take any of those?
So again, if you take a multivitamin, it also has multiminerals, and I get a little concerned about, for example, copper may lead to increased risk of cancer. Iron. I see so many patients who are anemic, and they say, oh, I'm taking an iron supplement. Most of my cancer patients are anemic from their chemotherapy and not iron deficiency. Iron feeds cancer. That's one of the problems with red meat. I haven't done dairy for 28 years, and dairy is our major dietary source of calcium. So I take a little bit of calcium. I say a little bit because too much calcium supplementation in men can lead to aggressive prostate cancer. So I take about 300 milligrams a day. And calcium can constipate. Magnesium does the opposite. So what I take is a CalMag. They're both together, and there's half as much magnesium as the calcium. And those two are both good for bone health as well as for protecting against colon cancer. Zinc is another mineral that I take every few days. Zinc is good for prostate health, and it's also good for collagen and wound healing. So patients undergoing surgery, I recommend vitamin C and zinc. And again, yeah, I think zinc is also good for immunity. There was a big run on zinc during the beginning of COVID. And there are some preparations that are calcium, magnesium, and zinc all in one. So that makes life a lot easier. Another mineral that patients like to take is selenium. And again, in the study of vitamin E in prostate cancer, actually selenium increased the risk of diabetes, and it also increased the risk of prostate cancer. So I say eat a Brazil nut. One Brazil nut gives us all the selenium we need for a daily requirement.
Okay. What about, you've covered general immune system support through vitamin D and vitamin C and zinc. What other things do you consider for general?
Well, you know, I like medicinal mushrooms, and we did a whole chat on medicinal mushrooms. Some of those are really good for immune enhancement, particularly Trametes versicolor or turkey tail. I have a whole cabinet full of mushrooms, and you know, sometimes I take cordyceps to energize me. I have a mushroom botanical combination called brain that I take when I'm a little foggy, and ding, it gives me a little zing. And I also like hericium, which is lion's mane, also good for brain and nerves. And then there's a 17 mushroom blend that I take when I think I'm going to be exposed to viruses, because I think it's a good antiviral. I also like a refrigerated probiotic. We appreciate the contribution of our microbiome to our overall health as well as our immune health. And, you know, I think my microbiome is fine, but every once in a while I do take a refrigerated probiotic that contains lactobacillus and bifidobacterium, because I think those are good bacteria.
You've talked about your arthritis before. Anything for your arthritis?
For years, I've taken glucosamine and chondroitin, and the studies on that are always variable. Does it work or doesn't it work? I think my arthritis is in small joints in my hands and feet. I think the research has shown that the glucosamine chondroitin is not effective for hip and knees. So I continue to take my glucosamine chondroitin. Turmeric was really a boon to me when I had a big flare of swelling, tenderness, pain, and redness in this joint here. I started taking curcumin with black pepper. Curcumin is the active ingredient in turmeric. Black pepper increases the absorption of turmeric, so it gets absorbed from the upper GI tract as opposed to getting all the way down to the colon, where it does help protect against colon cancer. So turmeric can also be modified, so it's absorbed easier from the upper GI tract without black pepper. And the reason I say that is I caution my patients who take a lot of oral pharmaceuticals to avoid taking curcumin with piperine or black pepper at the same time, because they might overdose on their pharmaceuticals. I also like fish oil as an anti-inflammatory. It's a little bit antidepressant as well. And for some people, if you take enough, it can also be a bowel lubricant. So all of those, I think, are good for joints.
So last thing to sleep. Do you take anything for sleep?
Sure, yeah. Especially COVID-somnia has affected me a bit. You know, I'm told that I sleep 9 hours a night, but I don't feel like it. So melatonin, of course, is the hallmark of sleep aids. It's what our own brain makes to tell us it's nighttime. It's shut off by blue light if we watch TV or look at our computer or our eye products at night. That shuts off our melatonin. So I take a little melatonin. I also started taking some magnesium threonate at night. Magnesium is calming. I take magnesium in the morning with my calcium and magnesium, but I also take a little bit at night too before I take my melatonin. I also use a sleep aid that's 6 different botanicals, including hops, lavender, California poppy, lemon balm, etc., and has a little melatonin. I don't think it's good to take the same thing every day or every night. Sometimes I use a cannabis-based sleep aid, but I do mix and match. And I tell my patients all the time, I stop all of my supplements the last 4 days of every month, just to give my body a chance to clean out. And on the first of the month, it says, yay, they're back again. Because I think if you do something every day, your body's going to become immune or resistant to it. Not pharmaceuticals, but supplements.
Thank you, Dr. Abrams. This was a fantastic insight into your personal regimen of supplements, what you take, what you don't like taking. And we look forward to another chat with you next week. Thank you.